Cardiologist, you're halfway up a familiar flight of stairs when your chest feels tight and your heartbeat suddenly becomes impossible to ignore. You stop on the landing, pretending you're checking your phone, while your pulse thumps hard against your ribs. Maybe it settles within a minute. Maybe your primary care doctor notices that your blood pressure stays high, your cholesterol has climbed, or your heart rhythm doesn't sound quite regular. That's when you may be referred to a cardiologist, a doctor who specializes in your heart and blood vessels. Your heart isn't working alone. It's the center of a cardiovascular network that moves oxygen, nutrients, hormones, and waste through thousands of miles of blood vessels. A cardiologist studies how that system pumps, circulates, speeds up, slows down, and sometimes struggles. They may use an electrocardiogram to examine your heart's electrical activity, an ultrasound to watch it pump, or a stress test to see how it behaves when you exert yourself. What makes a cardiologist different from a heart surgeon is that most cardiologists diagnose and manage heart problems without performing open surgery. Some complete additional training to open blocked arteries or correct abnormal rhythms through catheters, but a cardiac surgeon handles operations such as bypass surgery. Your heart works quietly enough that you can forget it's there. A cardiologist pays attention when it stops being quiet. Dermatologist, you're getting dressed when you notice that the small patch near your elbow is still there. It doesn't look dramatic, it's just dry, red, and stubborn, and the moisturizer that usually fixes everything hasn't touched it. Or maybe a mole seems slightly different from the way you remember it, though you can't say exactly how. You start comparing it with old photographs, which is rarely a relaxing use of your morning. A dermatologist is a doctor who specializes in your skin, hair, and nails. Your skin isn't merely wrapping. It's an active organ that helps control temperature, blocks harmful organisms, responds to injury, produces immune reactions, and lets you feel the world outside you. That means a dermatologist may treat acne, eczema, psoriasis, infections, hair loss, nail disorders, allergic reactions, and skin cancers. They often diagnose problems by examining patterns because the location, shape, texture, and color of a change can reveal what's happening beneath the surface. They may also take a small biopsy when appearance alone isn't enough. What makes dermatology different from cosmetic skincare is that dermatologists are physicians trained to diagnose disease, prescribe medications, and perform medical procedures. Some offer cosmetic treatments too, but that's only one corner of the specialty. Your skin keeps a visible record of irritation, sunlight, hormones, aging, and time. A dermatologist learns how to read that record without assuming every mark tells the same story. Neurologist, you're sitting at your desk when two fingers begin tingling for no obvious reason. You shake your hand, stretch your wrist, and wait for the sensation to disappear. Another day, a headache arrives with flickering lights at the edge of your vision. Or someone close to you keeps forgetting conversations they genuinely believe never happened. These experiences can begin in completely different places, but they all involve the nervous system. A neurologist is a doctor who specializes in conditions affecting your brain, spinal cord, nerves, and often the way those structures communicate with your muscles. Your nervous system is your body's electrical messaging network. It helps create movement, sensation, language, balance, attention, memory, sleep, and awareness itself. A neurologist may investigate migraines, seizures, multiple sclerosis, Parkinson's disease, dementia, neuropathy, strokes, tremors, and unexplained weakness. The examination can look surprisingly simple. You may be asked to follow a finger, walk in a straight line, identify a sensation, or push against the doctor's hand. Those small tasks reveal which pathways are working and where a signal may be getting interrupted. What makes a neurologist different from a neurosurgeon is that a neurologist generally diagnoses and medically manages nervous system disorders, while a neurosurgeon performs operations on the brain, spine, or nerves. Your brain makes nearly everything feel like one continuous experience. Neurology begins by noticing the tiny places where that continuity breaks. Endocrinologist, you're doing most things the way you normally do, but your body seems to be following a different set of instructions. You're exhausted after sleeping. Your weight shifts without an obvious change in routine. You feel unusually thirsty, too hot, too cold, shaky between meals, or wide awake when you should be slowing down. Nothing feels dramatic enough to explain everything, yet several small things seem wrong at once. An endocrinologist is a doctor who specializes in hormones and metabolism. Hormones are chemical messengers released by glands such as your thyroid, pancreas, pituitary, adrenal glands, ovaries, and testes. They travel through your bloodstream and help regulate blood sugar, growth, reproduction, stress responses, bone strength, energy use, temperature, and much more. When a hormone is too high, too low, or arriving at the wrong time, the effects can appear across your entire body. Endocrinologists commonly manage diabetes, thyroid disorders, osteoporosis, adrenal conditions, pituitary disorders, and certain reproductive hormone problems. They often interpret patterns across blood tests rather than relying on one isolated number, because hormones interact and can rise or fall throughout the day. What makes endocrinology different from simply treating one symptom is that the specialist looks for the signaling problem connecting several symptoms together. Your body runs on messages you never consciously hear. An endocrinologist steps in when the messages and the response no longer seem to match. Gastroenterologist, you finish a meal you've eaten many times before, but tonight your stomach feels painfully full after only a few bites. Later, there's burning behind your breastbone, cramping that comes in waves, or an urgent trip to the bathroom that rearranges the rest of your evening. You tell yourself it was probably the food. Then it happens again, and eventually, your daily plans start including a quiet mental map of every nearby restroom. A gastroenterologist is a doctor who specializes in your digestive system, including your esophagus, stomach, intestines, liver, gallbladder, bile ducts, and pancreas. Digestion looks mechanical from the outside, but it depends on coordinated muscle movement, enzymes, acid, bile, nerves, immune activity, and trillions of microbes living inside your gut. A gastroenterologist may treat reflux, ulcers, irritable bowel syndrome, inflammatory bowel disease, liver disease, swallowing problems, chronic constipation, persistent diarrhea, and digestive bleeding. They may use endoscopy or colonoscopy to examine areas that ordinary scans and blood tests can't fully explain. What makes a gastroenterologist different from a general stomach doctor is the breadth of the system they manage. Pain near your stomach may actually begin in your esophagus, pancreas, liver, gallbladder, or intestines. Your digestive tract spends all day turning the outside world into part of you. You usually don't notice the complexity until one step in that long process stops cooperating. Rheumatologist, you wake up and your hands feel older than the rest of you. Your fingers are stiff, your joints ache on both sides, and opening a jar requires an unreasonable amount of negotiation. After you start moving, things loosen a little, but the stiffness returns the following morning. Maybe there's also swelling, fatigue, a recurring rash, or a fever that comes and goes without a clear infection. A rheumatologist is a doctor who specializes in inflammatory and autoimmune conditions affecting joints, muscles, bones, and connective tissues. Your immune system is supposed to identify threats and protect you. In autoimmune disease, parts of that defense system can mistakenly attack your own tissues, creating inflammation that may travel far beyond a single painful joint. Rheumatologists manage conditions such as rheumatoid arthritis, lupus, gout, vasculitis, scleroderma, and several forms of inflammatory arthritis. Diagnosis can take time because these illnesses often imitate other problems, and there may not be one test that settles everything. The specialist pieces together your symptoms, physical examination, blood work, imaging, and the pattern of how the condition changes over time. What makes a rheumatologist different from an orthopedic surgeon is that rheumatologists usually treat systemic inflammation medically, while orthopedic surgeons repair structural problems involving bones and joints. Your immune system protects you through recognition. Rheumatology deals with the difficult moments when that recognition becomes confused and your own body is treated like an intruder. Pulmonologist, you're lying in bed when you become aware that breathing is taking effort. Not enough to panic. Just enough that every breath feels like a task you're now performing manually. Or you've had a cough for weeks. Climbing stairs leaves you winded, and the inhaler that once helped doesn't seem to last as long. A pulmonologist is a doctor who specializes in your lungs and respiratory system. Your lungs bring oxygen into your bloodstream and remove carbon dioxide. But successful breathing also depends on open airways, flexible lung tissue, a moving diaphragm, healthy blood vessels, and signals from your brain. Pulmonologists may treat asthma, chronic obstructive pulmonary disease, pneumonia complications, pulmonary fibrosis, lung blood clots, and other conditions that interfere with airflow or oxygen exchange. Some also specialize in critical care or sleep medicine because breathing problems often become especially important in intensive care units and during sleep. Tests may include breathing into a machine to measure airflow, checking oxygen levels, examining chest imaging, or using a bronchoscope to look inside the airways. What makes a pulmonologist different from an ear, nose, and throat specialist is location and function. An ENT doctor usually focuses on the upper airway, while a pulmonologist concentrates mainly on the lungs and lower respiratory system. Breathing is automatic until it isn't. Pulmonology is built around protecting the quiet rhythm you depend on more than any other. Nephrologist. You're at a routine appointment expecting the usual conversation when your doctor pauses over your blood work. A kidney measurement has changed. Maybe your blood pressure has been difficult to control, your ankles are swelling by evening, or a urine test contains protein that shouldn't be there. You may feel completely normal, which makes the concern harder to understand. A nephrologist is a doctor who specializes in your kidneys and the medical conditions that affect them. Your kidneys filter waste from your blood, balance water and minerals, help regulate blood pressure, support red blood cell production, and contribute to bone health. They're doing chemistry all day, quietly. When kidney function declines, symptoms may appear late because the body can compensate for a long time. Nephrologists manage chronic kidney disease, sudden kidney injury, difficult blood pressure problems, electrolyte imbalances, inflammatory kidney disorders, and dialysis care. They examine trends in blood and urine testing because one abnormal result doesn't always tell the full story. What makes a nephrologist different from a urologist is that nephrologists usually manage how the kidneys function, while urologists treat structural and surgical problems involving the urinary tract, such as certain stones, blockages, or prostate conditions. Your kidneys rarely demand attention while they're working well. A nephrologist listens closely to the small laboratory signals they send before your body has found louder ways to complain. Hematologist, you notice bruises on your legs and can't remember earning any of them. You feel tired in a way that sleep doesn't repair, or a small cut seems to bleed longer than expected. Then a routine blood count comes back with numbers outside the normal range. Red cells, white cells, platelets, hemoglobin. Suddenly your blood, something you almost never think about, becomes a page filled with unfamiliar abbreviations. A hematologist is a doctor who specializes in blood, bone marrow, and the systems involved in clotting and bleeding. Your red blood cells carry oxygen. Your white blood cells support immune defense. Your platelets and clotting proteins help seal damaged vessels. Most of these cells begin inside your bone marrow, where production has to remain remarkably balanced. Hematologists manage anemia, clotting disorders, bleeding disorders, abnormal blood counts, sickle cell disease, bone marrow conditions, and blood cancers. Some hematologists also train in oncology, which is why you often hear the combined title hematologist-oncologist. What makes a hematologist different from an oncologist is that hematology includes many non-cancerous blood problems, while oncology focuses on cancer. The fields overlap when cancer begins in blood-forming tissues or affects blood cells. Your blood reaches nearly every part of you, carrying oxygen, defenses, heat, and chemical messages. When something changes within it, the clues may appear everywhere and nowhere at the same time. Infectious disease specialist, you finished the usual treatment, but the fever returns. The infection is behaving strangely. The laboratory can't immediately identify the organism, or the medication that normally works isn't working this time. Maybe you became sick after international travel, developed an infection involving several organs, or need long-term treatment that requires careful monitoring. An infectious disease specialist is a doctor trained to diagnose and manage infections that are severe, unusual, complicated, persistent, or resistant to standard treatment. The cause may be a bacterium, virus, fungus, parasite, or another infectious agent. The specialist considers more than the name of the germ. They look at where it entered, how it's spreading, how your immune system is responding, what exposures you've had, and which medications can reach the infected tissue effectively. They often interpret cultures and other laboratory results, then choose treatment that targets the organism without using broader medication than necessary. That matters because overusing antimicrobial drugs can encourage resistance, allowing the organisms most able to survive treatment to multiply. What makes this specialist different from the doctor treating an ordinary infection is complexity. A routine ear infection may never require one, but an infection that's hidden, recurring, resistant, or affecting a vulnerable patient may. It's not mysterious. It's biology under pressure, adaptation happening quickly, and a doctor trying to stay one careful step ahead. Physiatrist, you've recovered from the illness, surgery, accident, or injury, at least according to the date on the calendar. But your body hasn't returned to the life you had before it. Walking across a room takes planning. Your shoulder moves, but not without pain. Your hand is technically strong enough to hold a cup, yet the movement feels awkward and unreliable. A physiatrist is a physician specializing in physical medicine and rehabilitation, often shortened to PM&R. This is one of the less familiar specialties, partly because physiatrists focus less on one organ and more on how your whole body functions in daily life. They may care for people recovering from strokes, spinal cord injuries, brain injuries, amputations, major surgeries, sports injuries, chronic pain, or conditions that affect movement and independence. A physiatrist can coordinate medications, injections, diagnostic testing, therapy, adaptive equipment, and rehabilitation goals. They often work closely with physical therapists, occupational therapists, speech therapists, prosthetists, and other professionals. What makes a physiatrist different from a physical therapist is that the physiatrist is a medical doctor who diagnoses conditions and directs the broader medical rehabilitation plan, while the therapist provides focused treatment sessions that rebuild specific abilities. Medicine often measures success by whether you survived or whether the disease is controlled. Rehabilitation asks another question: what kind of life can you return to now? Sometimes healing isn't restoring who you were. It's helping you build a workable path forward from where you are. Give this video a thumbs up, subscribe for more explained topics, and leave your suggestions in the comments. Your idea could inspire a future video.